Hi, this is Dr. Frank Torelli, chiropractor and doctor of pastoral science. How are you today? I'm with you today because you either shared my email through my office or during one of our seminars. And I hope you open up these emails if you're interested, especially in your health. If you're not interested, open them up anyways, because there will be tidbits of free information from a doctor who knows a lot about health. There's a big difference between medical practice and naturopathic or alternative practices. Both are essential in the American way of life. The differences, though, are far apart, and at times they do come together. So these videos will be small clips of information that you can use on a day-to-day basis from a natural standpoint to help you with your healthcare challenges. You may also start asking questions about are there other ways to look at your situation. Whether you want to maintain your health or you want to get your health back again. We may have some answers for you. This whole concept of videos, I was just looking at myself on the screen, and I realized just how big my nose is. My wife says she loves me for my nose, and looking at this video, I wonder why. But nevertheless, we're going to go over some topics through the next few months, and please share this with your friends, because this is about helping you to help yourself and not rely on either myself or medical doctors for every little thing that comes your way. Because if you work on foundational elements of getting your health or maintaining your health, a lot of times the situations that get out of control are more easier to maintain and to correct. So what I want to talk today, I'm going to go on my list so I don't get off track. I'll end up spending an hour on this instead of a few minutes. We're going to talk about inflammation. Okay, and so put my glasses back on because I'm getting up there too. Basically, when we think about conditions that affect our health, whether it's heart disease, cancer, migraine headaches, joint pain, joint stiffness, even some of the autoimmune diseases like Hashimoto's, MS, rheumatoid arthritis, what is the common factor that all of these things have? And the answer is one thing and one thing only. The common factor is inflammation. We know the cause of disease right now. 95% of all diseases are based on stress, lifestyle, and environment. They're not genetic. Genetic is only about 5%, believe it or not. So you have the ability through controlling your lifestyle to controlling the outcome of your health. Whether you're going to get your health back, whether you're going to maintain your health, or if you choose not to follow some of these common sense approaches, this good information. Information is great, but if you don't act on information, it's useless. There's zero value to it. And remember, this information is going to be free. Now, I'm not going to give you every single secret that I have in the world, okay? But I'm going to give you some sound bites of information that you need to do, that I do on a day-to-day basis, and that I've taken the time to look up and to get myself educated on. We'll share that with you at little bits and pieces so that you can work with this. So let's look at this briefly at inflammation. We're going to cover the topic of inflammation and its cause over the next few months with these short videos. Now, the symptoms that we kind of look at, or the things that are going on, relate to basically headaches and migraines. All right. We're going to cover gut issues, stomach issues, digestion. We're going to cover arthritis and stiff joints, sleep disorders, insomnia, fatigue, mood swings, and anxiety. Now, why is a chiropractor talking about these things in addition to even teeth, gum, bad breath issues? Okay? Because as a chiropractor, I'm always looking at the cause of the problem. So even if it's a spinal misalignment and you're coming in with a misalignment in your neck that's causing a headache, where is that misalignment coming from? Okay? Is it caused by stress? Is it caused by injury? Is it caused by food? Is it caused by chemicals? All right? So if we correct the misalignment in the spine and it keeps reoccurring, then the question is, do you need a physical adjustment, or maybe you need a chemical or a lifestyle adjustment? And keep in mind, as a chiropractor, I truly believe that almost all disease processes can be found in the spine. And this has been proven indirectly by other medical doctors through autopsies and correlating spinal degeneration changes with the cause of death and on an old age patient. We're not talking about somebody who had a gunshot wound or somebody who necessarily got cancer and died, but we can actually look at the spine and its condition. Okay, in other words, the stress on the spine and how it affects certain organ systems. What part of the spine is degenerative will dictate what part of the body is degenerating also. So, an example, we can have an issue with low back pain caused by a degenerative disc caused by a lifting injury at the age of 25, let's say on a construction site, when you were out maybe helping somebody work for a few months after you got out of college. Okay, this happened to me. So you blow out L4, it heals over a period of time by itself, with therapy, it doesn't matter. But now that disc is degenerated, so it's going to continue to kind of smolder and move along. And so that L4 or that L5 disc may actually cause a weakness to organs down in that region. And for men, I mean, when you look at L5, I think right off the bat, I think of prostate. All right? So did the back condition come before the prostate, or did the prostate condition come before the back condition? The chicken or the egg? That's the big question. But one of the things we will know is that there's inflammation. So all the things that we're going to talk about is how to reduce inflammation on a natural level without, popping pills and aspirin, because we know that's not the answer. Okay? There's so many side effects with these medications when used too regularly or too much. But adding decent foods or cleaning up your diet, exercising properly, seeing the chiropractor, seeing your medical doctor for evaluations and things like that, balancing out your health care and taking charge of what you can do inexpensively, okay, or cheaply, saving you money, and non-technical. You don't have to always do really high-tech things to get the results done. So that's what we're going to cover. And be open-minded with this. And again, you don't like the email, open it up and read it anyways. Okay, right now I'm not selling you anything. I'm just giving you information. We'll have some opportunities for you to step up and come to our larger talks. We really cover a large process that we work with in the office that we've got people into right now. It's based in lifestyle, functional medicine, special tests that are done to figure out what's really going on with the body, and then how can we fix these things from a natural standpoint, or working with a medical doctor to get you back on track. So that will be down the road, and you'll know when that comes in. Those invites will be very specific. But right now, look forward to information from the office, from my heart, my mind, to your life, and read the information and act on it. Okay? So thank you, and have a great day, and I look forward to talking to you and showing my big nose to most of you in the near future. Thank you very much.